We continue our effort tonight to fight fear with facts as the coronavirus pandemic continues to impact communities across the globe. Infectious disease expert Dr. Ruth Berggren from UT Health San Antonio is back with us this week to help us get answers to our coronavirus questions. Thank you, Dr. Berggren, for being with us as you are every Tuesday. I appreciate it.
Good evening.
So I know that you're part of the city-county health transition team, and the first question has to do with that. Your first meeting was today, I believe. A rough draft of the plan to get us out of social distancing is supposed to be Friday. What can you tell us? I mean, I know you're probably in the very early stages of this whole thing, but what can you tell us right now?
So tonight was actually our second meeting. We did have a meeting over the weekend. And first of all, it's an incredibly great group of people that I am privileged to be a part of. You know, we've got health experts that include infectious disease doctors like me, but we have hospital leaders, we have epidemiologists, we have ethicists, and all sorts of public health experts. We also have representation, as you might expect, from Metro Health, but also from University Health System and other UT Health is there, and a lot of other organizations. So it's a good group of people. What we've been able to agree upon so far is guiding principles. Those are really, really important and probably worth sharing a little bit if I could. Yeah. It's really important to state at the outset that we strongly believe that human health and economic well-being are tightly linked. And we prioritize human life in the face of this pandemic, recognizing the necessity of strengthening our community's economic well-being at the same time. And we know that continued and severe economic hardship undermines the health of a community just as much as disease. So we value working hard, caring for people across generations, protecting those who are medically at risk, ensuring that no one is left behind. And these are the shared values that we believe will guide a transition towards economic recovery, and an economic recovery that's balanced by preserving the safety and the integrity of our community.
Yeah, it's a balancing act is really what it is when you're talking about the health transition team. And then we've got the economic transition team as well. All right, let's get to some of our viewer questions. The first one is, sometimes people who have COVID die from other issues. What determines if a death is considered COVID-19 related?
So excellent question. And at the end of the day, that will possibly leave some people scratching their heads because there can be cases where it's nuanced, right? But just to make this question very plain to everybody, if I have mild COVID, I go out and get into a car accident and I die while I have COVID, we wouldn't call that a COVID-related death, although I had COVID when I died. Yeah. So that's kind of a simple case where it's very obvious. Others are more nuanced because, Steve, the folks who die with COVID are often those who have serious underlying conditions, heart conditions, lung conditions, diabetes, high blood pressure, congestive heart failure. And so if you see a worsening of one of those conditions in the setting of really severe COVID, there could be multiple factors at play in a person's death. But I think it's a matter of degree. If the person was really sick with COVID and they had other diseases too, and then they die, it's probably a COVID-related death.
Yeah, very well put. All right, is there a plan in the event that positive cases go up due to opening businesses too soon?
Yeah, so that's the sort of thing that our transition team is developing guidance for, just exactly that. And I think the public should be prepared to realize that there may be some cyclical nature to this reentry into the new normal. That as we monitor and evaluate the outcome of our plan, we're going to have to recognize that if cases are going up in a certain sector, we're going to have to pull back within that sector and impose more strict behaviors, more strict restrictions, as it were. So that is what we're working on right now. What are the triggers? What are the indicators? How do we know when we can move forward and when we need to pull back?
Yeah, there has to be flexibility built in.
Yes, and people need to be prepared for that, and don't believe that we somehow erred if there has to be a pullback. That's the nature of infectious disease, and it's the nature of trying to make predictions.
Yeah. All right, next question. As an essential employee, if I don't feel well and I have a temperature, should I get a test? I'm guessing she means a COVID-19 test before going back to work.
Yeah, so the first thing I'd recommend is if you've got a fever, please go to the sanantonio.gov website, fill out the online questionnaire, and get guidance. It's very likely that that guidance will tell you to go and get a test. And then ultimately, when you come back to work is something that should be determined in consultation with a physician and also your work supervisor.
All right, the final question is, what has to happen for things to get back to normal?
Well, that's an important part of the plan that we're working on. We'll have a draft of this plan ready to submit to the city council and the county commissioner court by the end of the week. And we will have questions and feedback from them, and then ultimately a plan that we share with the public in the following week.
Is there anything you're seeing out there that's concerning you right now?
Well, I'm concerned that people are so excited about the antibody testing, and I feel like there's some jumping of the gun that's going on because we have yet to learn which antibody tests are really reliable and whether or not a positive antibody test truly correlates with being immune. And we wouldn't want to jump the gun and start making decisions about putting people into the workforce based on antibody tests until we have greater clarity about that. So it's a balancing act. It's an area that we're all following really closely.
Yeah, and even I saw a study today about hydrochloric that there's some questions about whether it's really effective when it comes to COVID-19 today.
Yes,
a new study.
The data there are looking kind of discouraging, and we're worried that there could be an awful lot of side effects to no good purpose. So we'll be waiting and watching on the studies that come out, but we are backing away from that because it's less clear that is really helping. Another area, though, that I am worried about is all the folks who haven't been taking care of their health during this COVID shutdown. And we worry that folks who've had to put off doctor's appointments may be suffering worsening of their underlying diseases. Folks who are diabetic, not monitoring their blood sugars, suffering from injuries that they don't get tended to, and then wind up having an infection, a diabetic foot ulcer, and so on. And there could be, we fear, waves of people that are sicker than they normally would be because they haven't been tending to their health. So what do we do about that, folks? Your doctors are at work. We're doing primary care through telehealth. Follow through, take care of yourselves, see your doctor, and try to be as healthy as you can be.
Yeah, absolutely. Good advice. All right, I always like to give you the last word, and you always give us a little nugget to take with us of the many nuggets that you give us. So I'm giving you the last word tonight.
Well, I was worried a month ago that at this moment we'd be having a terrible time, drowning in the emergency room and having to make dire decisions. And that is not the case. So congratulations to San Antonio. This has been an incredibly effective flattening of the curve. I don't mean to dismiss any of the cases that we had. There's been suffering, there's been death, but my goodness, we're seeing so much less than we thought we were going to see. And that is the result of this community working together, coming together as a team, paying attention, and really valuing human life. So that is heartening. Now we're entering a new phase. It's really something to celebrate. I'm so excited that I get to be on something called a transition team. That's fantastic. But we need people's patience and forbearance, and we have to continue to work together, be patient with each other as we move forward and move forward safely.
Dr. Ruth Berggren with the Long School of Medicine at UT Health San Antonio. Thank you for your time as always.
Happy to be here.
We'll be right back.